May is Mental Health Awareness Month. Dealing with mental health concerns is more accepted today than perhaps ever before, but how do companies deal with mental health issues in the workplace, where there may be a stigma that surrounds the topic? CHD, or the Center for Human Development, will be hosting a Mental Health in the Workplace forum on Friday, May 11th at the Employers Association of the Northeast in Agawam. The panel will discuss how companies can support employees and the legalities of supporting employees in the workplace. Carolee McGrath sat down with Fitzgerald and Kim Lee of CHD to learn more.
It's a very important subject, and it's one that deserves much more recognition and public discussion and conversation. You know, in our world, we like to think or refer to it as, silence breeds stigma. And so when you're not proactive and engaged in conversations around mental health, what does that say to those who might be struggling, with anxiety or stress or depression in terms of their ability to come forward or to feel comfortable seeking help? So during Mental Health Awareness Month, which is the month of May, CHD thought that it would be very appropriate, very relevant, and very timely for us to reach out to our good friends at the Employers Association of the Northeast to engage them in a panel discussion around mental health and most especially mental health in the workplace.
So you're going to also have an attorney on the panel as well. Of course, you're in human resources. For a company looking at this and trying to work with their employees, there's so many issues that come up, correct?
There are. It's complicated. Like a physical illness, a mental illness brings its own set of challenges to the workplace. But to Kim's point, it's about talking about it and making sure that we have environments that are friendly and welcoming and comfortable for folks with any number of illnesses that may be in the workplace.
Okay, but what about, you were talking a little bit about stigma, and I know that the goal, of course, is to get rid of that stigma. But if somebody is an employee and they struggle perhaps with depression or anxiety, they're probably not going to want to be upfront about that with their human resources manager, because they might feel like, gee, I'm not going to get promoted, or maybe people are not going to trust me with this task. How do you encourage employees, not to feel that way?
I think part of it is kind of breaking down that stigma is around the environment that you're creating, so that the person who may be having that struggle does feel comfortable talking to their supervisor about the challenges that they're facing at work, about a project that might be becoming more difficult because they may be becoming symptomatic, or it might trigger anxiety or be more stressful. So there are lots of things that we can do in the workplace to make that environment a bit more welcoming. And those are small things and those are big things. And some of the small things are just talking about mental illness like you would talk about physical illness. So if, for example, a family member is struggling with cancer diagnosis, people would talk about that at work. How is that person doing? What's the latest update? But if someone has a mental illness in the family, that might not be something that people feel comfortable talking about or know what to say. They might feel quite differently about that. So I think trying to encourage and talk about mental health the same way we do as physical health, that it's a condition, it's treatable, and that it's part of a lot of people's lives. And so to normalize it like that, I think, is the first step. So those are some of the small things that you can do.
And are there certain things that employers should put in place? Because for employers, of course, you always have your bottom line, right? You want, productivity. You want people to be doing what they should be doing. But on the other hand, you want to make sure that everybody is, happy and healthy. And of course, that would be the best work environment. How do you encourage employers to make it clear to their employees, what procedures are and how do they accommodate them?
There's, a couple of steps. Carol can speak more specifically, I think, from an HR perspective, but from a cultural perspective, from an environment, to make sure that managers have the right kind of training and adequate training, identifying signs and symptoms of mental health. And as to Carol's point, in terms of identifying those opportunities to have those conversations, diabetes, hypertension, cancer, are all illnesses or diseases that people will talk openly and freely about. And so promoting an environment or creating a culture within a workplace that says to employees as well as management and other staff that it's okay to have these conversations. It's okay to talk about how you're feeling. It's okay to talk about a project and how that might be affecting you, and your anxiety and or depression. But mental illness, in terms of anxiety, depression, specifically, will cost more to a workforce or to employers than diabetes and hypertension combined.
And I think that's a really good point, because the second you say that, I mean, it starts to make sense, I'm sure, to a lot of companies. But do you feel that here we are in 2018, that we've come a long way as far as the stigma goes?
Well, I think CHD is a unique organization because this is the work that we do. So for us, it is normal to talk about mental health issues in relation to work and how folks are affected. But I don't think that's the same in a lot of other organizations. So I'm hopeful that this panel will really provide an opportunity for folks who might not have had this conversation before to have it in a different way. When I go to the Employers Association, for example, I'm hoping always to take away 2 or 3 things from the experience, from the training, from the discussion that I can bring back to my workplace and say, okay, what do we need to do differently? What do I need to look at? So I'm hoping that happens here, is that there are 2 or 3 things that folks can do. Look at their policies, look at their benefits as an example. Are there things that are barriers for folks with mental health issues? Are there things that they're doing that are supportive? Or to Kim's point earlier, are they just simply silent? Do they not even talk about it? So I think there are things that employers can look at related to time off benefits, EAPs, having resources at the ready for folks, looking at their health insurance plans to make sure that those are robust in terms of the benefits and resources for folks that need mental health services. And also to look at what are the things you can do to accommodate someone who may be struggling temporarily,
right,
and happen to be symptomatic. What are those things that you can do to adjust the workplace, adjust the work, so that they can get through that period of time to get them back to being productive, fully engaged members of your workforce? Because it does cost a lot of money to have someone not productive at work. Our goal is to make sure that everyone that works for us can do the best that they can do, doing the best job. And for us, that job is an interaction with an individual. So someone's mental health is critical to the work that CHD does. So not only for our clients and the people that we serve, but for our staff as well.
And it's a new conversation, Carolee. It's not a conversation that typically human resource professionals may themselves feel comfortable with, or are overly educated on, or well informed about. And so to know that there is a resource in the community like CHD, who not only through this panel, but whether it's conversations with some of our professional staff, conversations with our clinical support folks, those are connections that CHD is happy to make throughout the community with HR professionals and managers who might just need a little support themselves in terms of navigating what can be a very new landscape for them.
Okay. Kim and Carol, thank you so much for coming in and talking to us about this. And the panel discussion is coming up on May 11th.
May 11th, 8:30 to 10 o'clock at the Employers Association of the Northeast's offices on Hunt Street in Agawam.
Great. Thank you so much for being here today.
Thank you.
Thank you.